This is my first official report to you as president, and my message today is simple. California needs physicians to step boldly into public leadership again. You can read the traditional report of my travels and presentations in your packet. Instead, I'd like to use this time to remind us who we are by going back to our beginnings. Can anyone identify this dapper young man? Kind of expected. If you know, you can say it. This is Dr. Benjamin Franklin Keene, one of the most significant medical pioneers in California history, and a member and a reminder that public service is in our professional DNA. Born in Massachusetts in 1813, he trained at the Jefferson Medical College in Philadelphia, began practicing in Georgia, and after personal tragedy, left his children with his parents and headed west. In 1850, he arrived in a rough, young California. There were about 100,000 people there, mostly in the north. Miners, prospectors, merchants, sailors, and scoundrels crowded into ramshackle camps and towns. There were probably about 200 physicians in the entire state. Cholera, smallpox, encephalitis, and typhoid tore through the population. Healthcare then was chaotic, dangerous, and often deadly for both patients and doctors alike. In that environment, a small group of traditionally trained physicians decided that structure and professional accountability had to replace the chaos. On March 12, 1856, the Medical Society of California, what would become our CMA, was founded by Drs. Keene, Elias Cooper, and Thomas Logan. They dedicated this new organization to, quote, promote the science and art of medicine, protection of the public health, and betterment of the medical profession. Dr. Keene was elected the first president. He was the first CMA president. That alone would have been a full career, but his story doesn't stop here. Dr. Keene was also a pioneering public servant. He was elected to the California State Senate twice and became the third Senate President pro tem. He was also the very first Democrat elected President pro tem in California's history. He even authored the bill that sent California Marble to help construct the Washington Monument. So from the very beginning, our profession did not stop at the clinic door. Physicians were shaping the laws and institutions of this young, volatile state. Now for the hard part of the story. Dr. Keene served as CMA president for less than a year. In 1856, he died of a sudden paralytic illness. We don't know exactly what it was, but we do know one thing that matters for our purposes today. He was 42. By 42, he had practiced in multiple states, helped found organized medicine in California, led this organization, served in the state senate and presided over it, and left his mark on our nation's capital. So, to our early career colleagues, don't let your youth disqualify you from leadership. History says you're right on time. What are the key takeaways from Dr. Keene's story? First, we have always faced profound, daunting social problems that seemed incredibly insurmountable. Cholera in mining camps then, complex chronic disease, behavioral health crisis, and inequities now. Second, public service is in our professional DNA. When society has needed leaders with integrity, critical thinking, problem-solving skills, and trustworthiness, physicians have stepped forward. Simply put, doctors make great public leaders. Our history confirms that. And that brings us to today. We have entered into another time of crisis. Our patients and communities face misinformation and the politicization of public health. Our workforce is strained and burned out. We see growing mental health needs, stark inequities, and health systems that often prioritize everything except the patient. Different century, different diseases, same need. Physicians willing to step into the public arena when it's uncomfortable. I dream of a time when it's normal, expected, to interview physician candidates for governor, for the U.S. Senate, for statewide office, not as a novelty, but as a continuation of what Dr. Keene started. We have led before, we will lead again. Public service is not an add-on to our profession. It is a continuation of it. It is in our history, in our DNA, and in our moment. It is our time now. And that's my report. Thank you.